Life is a gift. Every day we experience beautiful moments and surprises. However, there are also times when events such as accidents and illnesses afflict us and can cause severe crises. Vulnerability then expresses itself, not only in the bodily but also in the psychological constitution. For several years, health professionals have seriously discussed this holistic approach, which includes the spiritual dimension.
Mit spiritueller Dimension ist gemeint die.
With the spiritual dimension, we mean the fundamental questions in life.
Was trägt mein Leben?
What are my basic beliefs? What gives me strength and meaning?
Praktiken, die damit zusammenhängen, also bestimmte spirituelle Erfahrungen.
Spiritual experiences often are intense and can be essential resources. Sometimes they are also a problem. To incorporate such factors into a treatment plan or a therapy session, or in the question of how to deal with an illness, all this belongs to spiritual care. In situations which pull somebody out of his everyday life, spirituality becomes crucial. Questions about the origin and the purpose of life, as well as the afterlife, come up. Hans-Peter Imfeld suffered 2 heart attacks within only a few days.
Ich war beim Hausarzt und da hat man gesagt, ich habe einen Herzinfarkt gehabt.
I went to see my family doctor. He told me that I had a heart attack and instantly called the ambulance to transfer me to the university hospital. Arriving there, I had a second heart attack. After that, I don't remember anything until I woke up on the operating table. There, I realized that they were working on my heart. I was terribly afraid. Already in 1998, the clinic SGM Langenthal started to measure the outcome of its holistic treatment approach empirically. In 2005, the Independence Research Institute for Spirituality and Health, RISH, was founded. The main purpose is to promote research on the intersection of religion, spirituality, and health. In 2016, René Hefti, MD, became the head of the institute.
Der Hauptfokus des Forschungsinstituts liegt natürlich im wissenschaftlichen Bereich.
The focus of the Research Institute is to better understand how religion and spirituality interact with sickness and healing.
Welchen Einfluss hat auf Krankheits- und Heilungsprozesse.
Oft sagt man, ich glaube, ich denke, es ist so und so. Und wir bräuchten in vielem noch mehr Evidenz.
People say, I believe, I think. However, what we need is more evidence-based knowledge.
In seinem Institut eine ausgezeichnete Datenlage da ist.
The Research Institute collected empirical data from several hundred patients undergoing holistic treatment.
In manchen Bereichen die Evidenz.
Analyzing this data could extend our knowledge on the relevance of spiritual care.
Noch viel besser aufzeigen.
A further task of the Research Institute is to build networks among health professionals and researchers. Experts from German-speaking countries meet at the annual conferences of Spiritual Care Switzerland. At such conferences, new working groups, research cooperation, and ideas are developed, increasing the relevance of the topic at the national and the international level.
Wir sind ja beide zusammen in der internationalen Gesellschaft.
We are both members of the International Society for Health and Spirituality, whose president I am. I'm glad that there are regional initiatives everywhere that incorporate the political and cultural context.
I'm
impressed with René Hefti because he's been dealing with these issues for a long time as an internist and cardiologist and has been carrying them into the academic context. It is essential to include these topics in the education of young doctors, nurses, and other health professionals. We regularly do master theses with medical students and students of other health faculties. We also offer dissertations to young doctors. Micha Eglin has already written his master's thesis at the Research Institute for Spirituality and Health and is currently working towards his doctoral degree.
Also an der Universität ist es eigentlich nur am Rand behandelt wurde, das Thema
Spirituality was not a topic at the university. We had only one lecture about it, and there was an elective course on pastoral care and religiosity. However, it was not possible to conduct research on religion, spirituality, and health at our university. Another task of the Research Institute is to publish empirical research in academic journals. Review articles are also important contributions to the academic field.
Momentan ist meine Hauptaufgabe, Review-Artikel zu schreiben.
At the moment, I'm writing a review article about religious beliefs of healthcare professionals,
Zum Thema von Glaubensüberzeugungen von
mainly physicians and nurses, for the journal Spiritual Care.
Krankenpflegepersonen.
Dass natürlich Spiritual Care so ein Aufschwung erlebt.
Spiritual care becomes more important for two reasons. First, there is a growing interest for religion and spirituality in medicine and health sciences. Second, there is increasing evidence that religion and spirituality are actual resources in dealing with disease.
Dass das wirklich echte Ressourcen sind.
International studies, as well as findings of the Research Institute for Spirituality and Health, confirm that people who actively practice religion or spirituality have better health outcomes and can better deal with difficult situations in life.
Ganze Situation mit dem Herzinfarkt beim Hans-Peter.
When Hans-Peter Imfeld had his heart attack, the whole situation was very peaceful. There is always fear in such moments, but this was simply not the case.
Das steht nicht vorhanden gewesen.
Gott ist in den Schwachen mächtig.
God is strong in the weak. This carried me through and confirmed that my faith in Jesus Christ was real. God spoke to me even in such a situation. The consciousness that spirituality should be integrated into the treatment is growing, but the concrete implementation still needs further conversation, training, and mutual cooperation.
Die Herausforderung in diesem Themenbereich ist die Interdisziplinarität.
The challenge of spiritual care is the interdisciplinary approach.
Zusammenarbeiten muss, sich koordinieren muss, also ein interdisziplinäres.
Professional role models change, and the borders between the disciplines get more permeable.
Grenzen auch aufgelöst oder manchmal sogar überschritten.
The Research Institute for Spirituality and Health contributes with its research and training substantially to the development of better and more holistic patient care, so that relatives and health professionals will experience more positive examples in the future.
We
had the biopsychosocial revolution. This has really changed the medical context. I believe that there is a need for a further extension of this model. I wouldn't call it a spiritual revolution, but an integration of the spiritual dimension in the psychosocial framework, delivering religious and spiritual resources in patients and health professionals as well. In this regard, we wish every single patient all the best and much more.